Nearly 1 million people dead globally of COVID. How far away is the vaccine? India crosses 6 million infections. Is this the second wave? And the big question, is the worst yet to come? WHO has the answers.
Hello and welcome. You're watching the News Unlocked, the show that goes beyond the headlines to bring you the real stories that matter. COVID-19 continues to cause anxiety and stress across the world. The total number of COVID deaths are touching the 1 million mark. Where is the world placed today? Is the worst over, or is it yet to come? Those are some of the questions we want to raise. And joining us now to answer those questions, including that of the vaccine, are two very special guests. I'm joined from Geneva by World Health Organization's Dr. Soumya Swaminathan and Dr. Maria van der Kerkhoff, two individuals who are at the very top of their field as scientists with the WHO. Appreciate you doctors joining me on this very special show. The last time I spoke to you was around 3 to 4 months ago. The world today, compared to 3 to 4 months ago, how do you see it? Do you believe we are in a better place than we were, considering that COVID-19 hasn't gone away, deaths are closing in on the million mark? Why don't you start, Dr. van der Kerkhoff, with that? Are we in a better place?
Well, thanks for having us on the show, and it's good to see you again. Indeed, we're coming up to a very sobering and tragic milestone of almost 1 million deaths due to COVID-19. The world, it's very difficult to say exactly where every place in the world is because we're dealing with different intensities of transmission with this pandemic. On the one hand, countries are much better placed to deal with this virus. We know so much more about this virus than we did 3, 4, 5 months ago. We know what works in terms of breaking chains of transmission, in terms of controlling this virus. We know what works in terms of saving lives. And so there are a number of things that are in place right now where we have earlier case detection, earlier admission into hospital for clinical care for those that need it most, earlier access to oxygen and ventilatory support, dexamethasone for people who have severe and critical disease, and all of that is saving lives. And so we're in a much better position than we were a few months ago, but it's still quite precarious. And we are worried about some increasing trends in a number of countries across the world, not just increasing case numbers, but increasing hospitalizations and increasing numbers of admission to ICU.
Dr. Swaminathan, are you as optimistic, or is there, as Lancet said the other day, an element of false optimism in India across the world that the worst is over? Is the worst really over, ma'am?
I don't think we should get complacent, Rajdeep. I think we are still very much at risk of this pandemic progressing the way it has been over the past few months. We have to remember that 90% of the world's population is still susceptible to this virus. And therefore, the pandemic will continue, the virus will continue to grow and expand into areas and into populations where there are vulnerable people. I'm optimistic because I can start seeing the light at the end of the tunnel. And it's because of all the advances in science and technology and the global collaboration that's happened around that, driven by WHO and by our partners. And so whether it's vaccines or better diagnostics like the rapid diagnostic tests, or indeed better treatments that are currently being developed and tested in clinical trials, there are many, many ways. And we see this reflected in the lowering of the case fatality rates. That's the one good thing we've seen, is that compared to the number of people who are being infected and detected, the number of people who are dying from this disease has consistently shown a downward trend in India as well as globally. So there are a lot of signs of hope on the horizon, but we cannot let our guard down at this point. We have to continue with the public health measures that Maria mentioned till we have vaccines available for everyone.
Right. I'll come in a moment to the vaccines because I think there's a lot of interest in that. But just to understand what was just said, Dr. Van Kerkhoff, by Dr. Swaminathan, if all of you are saying that case fatality ratios are coming down, that's a good sign. We are seeing that in India as well. Is that because health infrastructures are simply now better prepared than they were 8 months ago? Or has the virus itself, in a way, over time become less virulent?
We are much better prepared now. We have much more experience with this particular virus and knowing how to care for patients. Our public health systems that are in place are better able to rapidly identify and detect cases, isolate those cases and care for them depending on the need, depending on their clinical presentation. Our hospitals are better equipped. Our medical professionals, our healthcare professionals are better trained. They have adequate PPE. We have treatments for the most severe patients. But as Dr. Soumya has said, we cannot become complacent because even with increasing case numbers in a number of countries, and we are seeing some positive signs of in other countries where there's a downward trend in cases, the more cases we have, the more opportunity this virus can have to find vulnerable populations. And vulnerable populations, those over 60 years old, those of any age that have underlying conditions, are at a much higher risk of developing severe disease and death. And so we have to prevent as many infections as we can while providing optimized care.
Let's come to the vaccine. Everyone now believes that to tackle COVID, not herd immunity, you need the vaccine. The general impression, at least till a few months ago, and I remember talking to y'all, is that we won't get a vaccine till the middle of 2021. Some said even later. Now we've got optimists even talking of as early as first quarter of 2021. I want to understand from you, Dr. Swaminathan, do you see a vaccine by the end of this year or the first quarter of 2021? Have we been able to actually fast forward a process that normally takes several years?
The good news is that we are now in a good situation with a large number of vaccine candidates in human clinical trials. As you know, they have to progress through the various stages. We have about 40 candidates now that have entered the first stages of human trials, and 9 of them are in the later stages, what we call phase 3 clinical trials. So even in this very accelerated pace of development, finally, when you enter the phase 3 clinical trials, you have to wait for the data on protective efficacy and safety. And this generally, at the very minimum, would take about 6 months from the time that you start that phase 3. The earliest trials started in July and August of this year, and so they may actually start reading out by the end of this year. And you've seen that many of the big pharma companies also put out a statement last week saying that they will not compromise on any of the standards of clinical trials before they seek licensure. And that's a very positive development because people need to be reassured that when a vaccine is being offered to them, that it's been rigorously tested. So I still believe that we will have results by the beginning of 2021, but that there will be vaccines for deployment around the middle of 2021. And even then will be in limited supplies and therefore will have to be given to the most high-risk groups. And that's something that we've developed, a fair allocation framework that WHO has worked on with the member states to identify how countries would progressively increase, the population that needs to be vaccinated.
That's very significant. What you're saying is that the earliest you believe is the first quarter of next year in terms of the tests being finally done and deployment in the middle of 2021 for the most high-risk groups. I say interesting because I had the CEO of Sputnik 5, the Russian vaccine, which is apparently making rapid progress. They claim that they're already now using the vaccine in Moscow, starting to use it. And they told me that in November, the vaccine will be available for commercial distribution in India. That's just about a month away. I want to understand, Dr. Van der Kerkhoff, Dr. Swaminathan, do you take that seriously when a Russian manufacturer tells me in November we'll have the vaccine available across Indian markets, and Indian company Dr. Reddy's has even tied up with them for distribution? Should we take such claims seriously, or are you both a little skeptical of the so-called vaccine nationalism, Dr. Van Kerkhoff?
Well, I think I will let Dr. Soumya supplement this, but just to say that there is a robust process that is in place for the development and clinical trials to develop a safe and effective vaccine. And that process is incredibly strong. Those steps need to be taken. And so as Dr. Soumya has outlined, there are a number of candidates that are in development, and the more vaccines that are in development, the more opportunities we have to succeed. But as she has said, we're looking forward to the results of these trials to see which ones are proving to be effective in terms of providing protection. And then not only that, making sure that they are safe, because we're talking about a large number of people that would need access to this vaccine.
Dr. Swaminathan, you want to add to that? The Russians telling me that by November they will be ready with commercial production of their vaccine?
So the one thing that has been different, I think, this time around has been that investments in commercial production and manufacturing have gone on side by side with the clinical trials. This doesn't normally happen. Companies wait for the results of their trials and wait for licensure of the product before they start scaling manufacturing. But because this is a pandemic, these kinds of at-risk investments in manufacturing have been made. Certainly the Serum Institute has invested, as have other companies in India in large-scale manufacturing, because the world is going to rely on India for supply of quite a lot of the vaccines. So it may be quite accurate for them to say that in November, they will be ready with the doses that are being manufactured. But when the clinical trial will finish and when the regulators will be able to see that data and provide either emergency use licensing or a full licensing, that really depends on so many factors. I understand they've just started their phase 3 trial and therefore the follow-up period, we're looking at a few months.
So you're looking at a slightly longer period than what the Russians are claiming, because Dr. Swaminathan, the Chinese have also claimed that they'll have a vaccine ready by the end of the year. As I said, Russians talking November. President Trump says he wants an American vaccine before the November presidential election. How seriously should we be looking at all these deadlines and timelines being spoken about?
We're tracking all of the vaccine trials that are going on around the world. And it is true that there are several Chinese vaccines now which have entered phase 3 clinical trials. Some of them are being done globally in countries around the world. And so again, it's the same thing. We need to wait for the results of those phase 3 clinical trials to come out. And we are optimistic that some of them will be out by the end of the year. And therefore, manufacturing, production capacity, etc., will start getting ramped up soon after that. We have also put out this week our guidelines for...
Go ahead. Go ahead, ma'am.
We have also put out this week our guidelines for the emergency use listing and pre-qualification of vaccines. Because a vaccine, once it completes clinical trials and has data which is presented to regulators, there are certain assessment criteria that are used. And so the WHO has put out guidance on how we may want to assess vaccines, both in terms of an emergency use authorization, but also in the longer term in terms of a WHO pre-qualification that we do for vaccines and drugs that allow global procurement agencies like UNICEF and Gavi to actually procure the millions of doses that will then be distributed.
But is there a worry? Is there a worry in all this talk about the vaccine that a commercial drive will take over the need to ensure safety? Is there a worry that all these timelines being spoken about may take away somewhere from the safety angle, ma'am?
We have been also talking to the global regulators. There's an international coalition of medical regulatory agencies. They have also been very keen to align with themselves and with WHO on these criteria that they're going to use. And I must say the commitment from most of the manufacturers and developers of vaccines so far that we've seen has also been to go based on the science. And so while everybody is rushing to finish the clinical trials, to scale up the manufacturing, to make the doses available, to set up the systems for vaccination campaigns, I think everyone agrees that ultimate decisions need to be based on the science. There's no disagreement on that.
So is there any vaccine which at the moment is way ahead compared to others in this race, if we call it a race? Is AstraZeneca along with Oxford University ahead of, let's say, Moderna or ahead of Sputnik? Is WHO looking at this as a race, or are you simply looking at ensuring first, safety first, and importantly, equitable distribution to those who need it most?
So the race is against the virus. And yes, we also would like to see vaccines developed in the shortest possible time, but without compromising on the basic principles of efficacy and safety determination. So the race, I think, is not between countries or between companies. It shouldn't be. It should be to get the best possible product in the least possible time and make it then available to as many people as possible around the world. So as I mentioned, there are several companies, including the ones you mentioned, Pfizer, Moderna, CanSino, AstraZeneca, the Gamaleya, the Russian vaccine, and a couple of other Chinese vaccines as well, Sinovac, which are in now in phase 3 trials, which will start giving us the data very soon. But I think our concern is really with having the right product available to as many people as possible and delivered in an ethical and equitable way.
Let me ask you, both of you, from your vantage position there in Geneva, let's look at India. Dr. Van der Kerkhoff, India continues to add about 80 to 85,000 cases on an average per day over the last few weeks. We are now the second highest country in terms of corona-affected infections. Recovery rates are also rising at the time, but the curve has not flattened. Does that worry you, Dr. Van der Kerkhoff, that in a large country like India, the curve is simply not flattening at the moment?
Well, I think as you said, it's a large country. And so what we try to do is we look at national trends, but more importantly, we're trying to see what's happening at the subnational level, because the virus isn't distributed equally across the entire country. This virus operates in clusters, and it likes, to be in close contact with people and operate in those types of outbreaks and amplification events and clusters. And the good news is now, while the vaccine is being developed, and as Sumya has pointed out, there are a large number of candidates and there are clinical trials underway, and we're working very hard to ensure that there is vaccine available for the most vulnerable people in all countries, as opposed to having vaccine available for everyone in only a couple of countries. That's really, really critical for us. But right now, we have tools within our power, within our capacities, and India is no different. I was actually just looking at some of the strategies that you have online and the guidance developments that you have through the ministry's website, and looking at the clinical care and looking at your testing strategy, looking at your surveillance strategy. You have tools in place right now to break those chains of transmission, to control those outbreaks. And we're seeing that happen. On the one hand, we're in a much better position to actually detect cases. And so we are seeing a trend in about a 7% reduction over the last week in case numbers and about a 2% reduction in deaths in the last week across India. That varies substantially at the subnational level. So what we recommend is not only having strong national plans, but having implementation, tailored, targeted implementation of all of these public health measures at the most local level, because there is where you can have the biggest impact if you make those interventions very specific to what is actually happening in terms of transmission.
Are you therefore telling me, Dr. Van der Kerkhoff, that India should not get scared at the moment by the fact that we are adding 85,000 cases plus per day? Instead, focus on testing more, focus on tracing, and believe that somewhere along the line, the cycle of transmission is slowly breaking. Are you telling me don't look at these top line numbers, ensure mortality rate is low, keep lowering that, increase your recovery rate, and you're on the right track? Am I correct?
Well, both of these numbers are important. You need to look at them both. But what I'm saying is that there are systems in place that are driving that mortality down, that are improving clinical outcomes. And it is very encouraging to see the recovery rate increase, because that's what we want to see. But we cannot become complacent. We have to remain at the ready. We have to learn how to live with this virus in the sense of keeping transmission low while we try to open up our societies. There's a delicate balance that we are all working through right now, this calibration period. And if we look at our data, and we look at our data every week, and we look at those trends, we can determine, do we need to put more pressure on the virus? Do we need to implement some stronger measures, or can we lift them a little bit more? But again, it's an iterative process. It's a dynamic process that needs to be done at the most local level.
Well, that is the big challenge of our times. How do we achieve that balance between lives and livelihoods? It's been a challenge from day one. I want to ask both of you, first you in conclusion, Dr. Van der Kerkhoff, I want to ask you, we heard from Dr. Michael Ryan, WHO's emergencies director, the other day. He went public saying 1 million is a terrible number of deaths. We need to reflect on that before we start considering a second million. When I hear that, does it mean we are still a long way away from actually getting this pandemic under control? Is Dr. Ryan being alarmist that the numbers could actually double, let's say, in the next 6 to 10 months?
So let me try to be as perfectly clear as I can. This virus is controllable. We have tools right now that can control transmission of this virus and save lives. Thinking about another million cases is just unfathomable. We have everything in our power to really drive those numbers down, and we need to do so. We must do so because we can. So there's an incredible, overwhelming solidarity across the world to come together and fight this virus. And our global strategy remains to suppress transmission, to save lives, and to save livelihoods. And we can do that. And while the vaccines are being developed and there's this incredible drive to have a safe and effective vaccine as soon as we can, plus to have the production, to have this vaccine available to everyone who needs it, especially the most vulnerable in all countries, we must do what we can right now to prevent transmission, and we can. It's very, very difficult to do. I'm not trying to minimize the difficulty to actually implement these actions that we've been outlining. And you hear us, if you ever hear us at these press conferences, we repeat over and over and over again all of the different things that can be done. But we need to make sure that we have strong leadership, strong national plans implemented at the most local levels. We have an empowered and engaged and enabled communities so that they know exactly what they need to do to prevent themselves from getting infected and from passing it to a loved one. But please make no question, do not question that we can control this virus because we have those tools at hand. It will take a massive collective effort for us to do so while we maintain our livelihoods, while we get essential services back online. But everyone who's listening to this should know that there are things that they can do themselves to keep themselves safe and keep their loved ones safe.
Well, Dr. Van der Kerkhoff, Dr. Soumya Swaminathan, in a sense, you've given us another wake-up call. This battle is not over. The WHO, coronavirus deaths have just crossed 1 million. That perhaps is part of that wake-up call. But I appreciate both of you joining us and giving us the benefit of your wisdom, and hopefully some of what is happening on the ground will slowly start yielding results. Thank you both very much for joining us there from Geneva on this special. That's it on this News Unlocked special. As always, news without the noise. Thanks for watching.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.